Okay, we're back again. Now we're going to talk about Chapter 1. So some of the questions that I have right here from our book says, why did I write this book? Well, as I mentioned before, it's very important for me to get information out to everybody. There was a need for it. Before I wrote the book, I looked online, I looked at the various booksellers, I went to libraries, and there really is not a lot of information out there that's put together. And so I felt there was a need, a niche, if you will, and I put together this book to fill that need. Why should I read this book? Well, I think anybody can get something out of the book. I wouldn't have written it otherwise. And so, no, it may not apply to you in terms of diabetes, but maybe the stroke issue, maybe the ethics behind that, perhaps a sexual pain issue, a lack of interest. And so that's a good reason to read the book. Why is it hard to get information about sexuality and issues from your physician? Well, this is actually, it's a great question. I heard this multiple times. Partially because we don't have all the answers. Partially is it's a question of time. I remember, I used to budget very little time for people, and we'd have people come in and they'd ask me about, I'm going to make up something, a sore elbow, and I really didn't have the time to go into a lot of other stuff. Now I schedule things so we do have the time. And so that's maybe perhaps another reason why people don't ask about sex, because they're not comfortable or they don't have the time to deal with it. What kind of doctor deals with sexual issues? Well, technically, any physician can, but we tend to see it more in gynecologists. We tend to see it more with urologists and perhaps psychiatrists. Those are the big three that we tend to see people ask sexual questions of. So here's a good question, number 1.8. I heard that sex is better with age. I'm not sure I believe it. Is it true? Well, my patients say it's true. It's something I hear over and over again. And so part of what I see is people say when you're 20, 25, 30, sex may be how should I put it, gymnastics. You might be trying to prove something, how many positions, how long, how many people you've gotten involved with. That tends to reduce with age. What we tend to see as people get older is sex is no longer a physical act. It deals with emotions. You're having intercourse with somebody that you care about. You're communicating. You're getting close to somebody. They did a study. There's hundreds of different reasons why people have had sexual intercourse. But as we get older, a lot has to do with emotional issues. And so it is important. It's a big part of a lot of people's lives. Oh, here's a question I get all the time. What is a senior? Well, I purposely wrote the book, the title, SeniorSex, so as not to lock out people. And so seniors are whatever you want it to be. It could be a senior in high school. It could be a senior citizen, and each definition is different. It could be somebody who feels senior. And so I purposely did not want to limit the audience. So I didn't want to write a book, Sex After 50, Sex After 60, sex in the golden years and all this kind of thing. I purposely wrote it open-ended so that anybody would feel comfortable picking up the book and getting something out of it. What other questions? Talks about me, and I mentioned that a few times already. Oh, number 113. Why is this book slightly slanted towards women? Well, being a gynecologist, dealing with women all the time, these are the questions that came to me. These are the questions that people had. And since they were females, I have a tendency to slant the book towards the female perspective. I did not ignore the males. So you will find information there, not only for yourself, but to understand your female partner. So that's our first chapter, and I hope you have a chance to look at the book. This first chapter deals with some of the issues. Of course, there's many more, and I welcome for you to look at the other chapters. Thank you.